So next we'll be talking about the vitamin K antagonists. These are oral anticoagulants, and probably the one that students are most familiar with is Coumadin. There is another form called Jantivin that you may run into. It's also a vitamin K antagonist, but Coumadin is probably the one we deal with most. And of course we know that Coumadin's generic name is warfarin. So Coumadin tends to kind of be our sort of our prototype when it comes to talking about these kinds of drugs. They work on different blood coag factors inside the liver, and they do that by interfering with the amount of vitamin K. Vitamin K has to be present to regulate a number of those factors, particularly factors 2, 7, 9, and 10. And when the vitamin K cannot get to those factors or is limited, the time it takes to form a clot is going to be lengthened. So we would say that our bleeding time would be longer. So Coumadin is used in all kinds of situations. Coronary artery disease, AFib to prevent those strokes that sometimes come about. They're used after orthopedic surgery when a person has to be still for a day or so, and after they've been cutting into vital areas that could be affected. And these vitamin K antagonists just generally prevent both blood clots, thrombi, and emboli. Vitamin K sub-Q is also the antidote for Coumadin toxicity. So remember, we had talked about the direct thrombin inhibitors don't have an antidote. If the person has too much on board, there's nothing they can do about it. Whereas with the PO vitamin K antagonists, all you have to do is give somebody a shot of vitamin K and it gets their levels back to where they need to be. Generally, a person's going to start on 2 to 5 milligrams of Coumadin, and then the healthcare provider will adjust their dosage based on two tests, the PT, prothrombin time, and the INR, and I'll cover those in a few slides. Coumadin is always PO. Occasionally, when you're in the clinical setting, you'll see a patient who's on heparin be started on Coumadin, and sometimes a nurse might think, oh my gosh, they're making a mistake here. And usually what it means is they're weaning a person off heparin and starting them on Coumadin. So they can be given concurrently, and it doesn't mean there's a med error, it just means that they're working on getting this person weaned off to Coumadin. Adverse effects and interactions with warfarin. Excessive bleeding is the biggest risk, once again, just the way it is with all of these anticoagulants and platelet inhibitors. Once again, you want to watch for bleeding gums when you brush your teeth, nosebleeds that come out of nowhere. In females, heavy menses, heavier periods than they would ordinarily have, and oozing from cuts that doesn't stop after a minute or so. It's not that anybody's going to bleed to death, but it can indicate that they have too much of this particular medication in their system, and it's interfering with their ability to clot. One of the worries about these PO anticoagulants is a very rare skin necrosis reaction. It hardly ever happens, you hardly see it, but when you do, most of the time you see it in a woman of menopausal age, so late 40s, 50s, who happens to be obese. For some reason, that's just the highest risk group. If you look in your textbook on page 273, figure 14.4 shows warfarin-induced skin necrosis. So that's pretty terrifying. You want to tell people to watch out for any skin involvement that might come up. And usually that's going to come about in the first 10 days of therapy. So you just need to tell people to watch for any unusual skin reactions. You see that in higher dosages usually. As with any drug, allergic reactions can be common, and sometimes, once again, you'll see alopecia or some hair loss or thinning with anticoagulants. Warfarin is very teratogenic. It is contraindicated in a pregnant woman. Usually if you've got a pregnant woman who's on chronic warfarin therapy, or a woman who's on chronic warfarin therapy for some reason, as soon as that pregnancy test comes back positive, they need to stop the warfarin and go to another method of anticoagulation. And usually that's going to be a low molecular weight heparin like Lovenox. Like I said, we use PT-INR, these tests, for evaluation of what the level should be. And vitamin K is the antidote for the overdose. And one of the trade names for vitamin K is phytonadione. There's some different generic or trade names, but this is one you commonly see. You want to watch your intake of leafy greens like kale, spinach, and other vegetables that contain large amounts of vitamin K, because they can interfere with the amount of vitamin K. The Coumadin is trying to limit vitamin K factors from getting into the clotting cascade and you want to lengthen that bleeding time. And if you load up with a bunch of vitamin K rich foods, you're going to interfere with that. So they don't tell people to stop them completely. If they're used to already eating a lot of vitamin K rich foods, they'll just tell people to kind of keep their diet stable, but they don't want to add them to somebody who's not getting them. And you don't want to abruptly stop either. You just kind of want to keep your intake level at all times. Oral contraceptives can interfere with anticoagulants, particularly ones like warfarin and Jantoven, and so a woman on oral contraceptives has to have her PT-INR tested also. All right, before I start talking about the PT and PTT, I've got another video that I would like you to watch. It's the Coumadin rap song. It's very corny, but it's kind of entertaining, and it gives an awful lot of information about Coumadin. So I'm going to go ahead and stop this section of the lecture right here and put the link on for the Coumadin rap song.